think there's a lot of myths with medication in general, but specifically with mental health medications. And I think that one myth is that you're broken if you have to take them. I think that there are ways that our brains function, and sometimes our brains need a little bit of help to boost up that certain neurotransmitters, certain ways that our brain can communicate and how we can communicate. And I think that we all could benefit in some ways from helping our brain to work at its best capacity. Another myth that I think is that well, if I go on this now, I'm going to be stuck on this forever. And that's something that every person is so individual, and every person has such a different path and a different treatment plan. And so just because you need a medication for a period of time doesn't necessarily mean that you're going to be stuck on this forever. The other thing I think with medication is that there's a lot of misconceptions that if I take something, I'm going to be addicted. I'm going to be stuck on it forever. But that's not true. There's side effects that we talk about and that we have to work through, but they're not medications primarily. I mean, there are some that we, of course, have to look at carefully, but they're not things that are going to be addictive, but they're things that are helping you and helping it so that your brain is functioning in the way that you want it to, so that you can have a happy, joyful life.